Can you see my screen?
Yes, we can.
Okay, so today we are looking at the pharmacy and the central medical supplies. The pharmacy depends on the central medical supply functionalities. So in a country, if the central medical store is not using the system, then it will be difficult for the pharmacy to use the system. And I'm going to show you how. When your account is created, you'll be granted permissions that hold the functionalities that relate to your job functionalities. Every pharmacist will have this welcome page along with the option to be able to switch pharmacy from the list of pharmacies in the country. When your account is created, the supervisor will assign or attach you to your current pharmacy at the time of creation. And if you work in a setting where you rotate pharmacies and dispense from different pharmacies at different clinic days, then you have the option to switch the pharmacy you are going to be working from on that particular day of use. For other users who are not pharmacists, the central medical store, you won't find this on the page, but you will see just the welcome page with the red screen like this. On the left of the page is the pages menu. When you expand this page, you will find a list of submenus. The list of submenus will be visible based on the permission that you have been assigned. So for central medical supplies, the only permission you will see is the central medical store and supplies permission, or the submenu, because your permission holds that submenu. And pharmacists will see the pharmacy submenu. If you have multiple rows, you are going to see all of the links to functionalities for all of the permissions that you have been assigned. So the focus for today is central medical stores and supplies and pharmacy. The functionality of the central medical store and supply is to create the medication list. In this case, we are dealing with the ARV medications. To look at the list of stock you've had, to edit or recall stock that you entered into the system, but for some reason you want to recall, to view the list of medications that have been recalled, and then to record distribution when you distribute stock to pharmacies, and you can view and edit your distributions in the event that you enter the wrong figure. The pharmacy is going to see the pharmacy submenu, and under the pharmacy submenu, there are lists of functionalities to create the stock. So they will enter the stock that the central medical supply has supplied or that they get from any supplies. They can view all of their stock. They can view all of the recalled stock. They can also dispense the medication for ARVs or for clients in care, and dispense PrEP and PEP medication for clients on those medications, but not HIV positive clients. They can print drug label after filling in the prescription, and then they can view all transaction history for a particular client, all of the dispense history. And then they can view the treatment plan of a client, just in case there's a pharmacy who wants to go through the treatment plan if there is a conflict in prescription or something. They can view the prescription history for a client, and then there will be a pharmacy level reporting where you can generate reports for your reporting obligations. So we'll start with central medical supplies, as the pharmacy depends on the entries from central medical supplies to populate the drop-down menu of the pharmacies. When you click on list of registered pharmacies dispensing ARV, this list is going to be populated based on the list that was configured on the system by the administrator. So the administrator will have the names of all the pharmacies dispensing ARVs. But Beyond HIV, you can use the system for all your stocks in the country. If you want to use it beyond the ARVs, but just register them. So the list of all the pharmacies will show here, and you can print them out. This is just for your information. When you want to record distribution, you know the only pharmacies on the list that distributions can go to. When a pharmacy is not on this list and you need to distribute, the administrator will have to update the list of pharmacies from the admin page to include any pharmacy that is not on the list. So once you verify the names of all the pharmacies that are registered on the system, you can now go ahead to create the ARV medication list. For today, we have a scenario we are going to follow to create this. Okay, Lester, you asked the question. You can go to the pages menu and look for Central Medical Store and Supplies sub-menu under the pages menu. And then when you expand that, you will see all of the functionalities we are discussing. So let me know if you found that so we can move on. Okay. All right. So once you go to create ARV medication list, you will have a list of the medications you have that you want to in stock that you want to enter into the system. So we are going to use this to fill in the system. So we have these drugs in this strength, in this form. We have the manufacturer's or the supplier's name. We have the expiry dates, the batch number, the packaging, the amount per pack, and the quantity. Now we are going to take note of packaging, amount per pack, quantity. In the context of the central medical supplies, when you come to enter your stock at the central medical store, you will put in the date you are recording this information, the name of the medication. So once you have the medication already there in the same strength, in the same form, the same manufacturer, the same expiry date and batch number, the system will think you are repeating the same thing and will not accept. But if one of the field is different, then it will accept it. So the first medication we have on the list, this, I'm going to enter this into the system. So the form of this is oral solution, so I'll say liquid, and the strength is 20 milligram per ml. The manufacturer of that is Viv Healthcare, and it expires August 2022. So I'll just put the last day of August in 2022. The batch number that we had there was 001, and the quantity is 2000. The packaging is in bottles, and each bottle contains 240 ml solution. So 240 ml. Now, this is where I said the quantity, packaging, and amount per pack matters. In the case of this oral solution, when we say the quantity is 2000, we mean we have 2240 ml bottles. If this was not oral solution, and let's say this was a tablet, and the tablet is packed in bottles, and they will have 30 packs per bottle. The quantity 2000 now means 2000 bottles of 30 packs tablets. So you're not counting the loose tablets. You are counting how many in a pack. In the event where you have loose tablets in a big container, then you can now put it as type is bottle and amount per bottle. So in the event where you have a container of 1000 tablets and you want to dispense by counting, in this case, you put your 1000 tablets. It is in the container, but in that container, 1000, you have one in that container. so that when you multiply the amount per pack by the quantity, it is 1,000. In the event where you have a bottle of 30 tablets in the bottle, then you are putting not loose tablets count, but the total number of bottles you have. So when you multiply 1,000 by 30, you get 30,000 loose tablets. Is it clear or confusing?
It's clear to me.
Okay. So you understand the quantity, packaging, and amount per pack. So for this, So for this, we have 240 mils in a bottle, and we have 2,000 of those bottles. So I'll put 2,000 back, and we have 240 mils per bottle, and you add that. And then we can go to the next medication and add it to the list. But I'll leave this for hands-on practice, and I'll put just the first medication. Once you have entered all your stock at the central medical stores, it is time you can review your stock list by going to the stock list menu. And when you click on that, it is going to give you the list of all the stock you have ever entered on the system, regardless of the quantity remaining. So if you have distributed all of that particular stock and your quantity is 0, you will have them on the list for future reference. And this list is searchable and printable. So by the time this list is so long and you have thousands of records, you will have it paginated on 10 per page. But the most recent stock comes first, and the ones from previous years comes last. And you can easily come here to search if you want to filter by a particular drug name. So if all I want is this drug, I start typing and it gives me just that medication or in all of the stock that the name starts with EM. So this way you can get to view all the stock you ever entered on the system. What will be displayed in quantity in stock is going to be the current quantity you have in stock. It will not give you the quantity you entered at the time you entered it. It is going to give you what you have presently. The next one is to edit or recall stock. So all of the drugs you've entered into the system will be displayed here, but not all of the fields. The only editable fields are the drug name, the form, the strength, the batch number. If you had made a mistake in this entry, you will have to use the recall button by selecting the reason, maybe error in entry. And then once you select that, you will come here to click on this recall sign, the red button. But if the purpose is not, you are not going to change, it's not going to be a delete or a recall, you ignore the last field. Let's say I want to change the batch number and I want to edit this. Then now I will click on the edit button and that field is updated. So the buttons are off for 2 reasons. One is to edit when you change this field. And this is to recall, which means you take it out of the list completely and out of your stock, and it will no longer be visible, but it will be part of your recall list. So let me recall this medication here. I want to recall this as a defective or potentially harmful, and I'll click the recall button. So this listing is now, will go out of my stock. I will no longer be able to distribute this, but when I come back to my view recalled, then I will see that that medication was actually entered, but was recalled as potentially harmful. It will give me the date and time that the recall happened and who did the recall. So you do a recall even if there's an error in entry, because the system will not allow you delete any errors. So you use recall so that when your supervisor looks at the list, they will see where you what you deleted and why you deleted it. It is going to remain on the list. Whatever you do in the central medical supplies in terms of recall and edit does not affect the pharmacies too much. What affects the pharmacies is the stock you entered. If you don't enter your stock at the central medical stores, the pharmacy's drop-down menu will not be populated with the type of drugs available in the country. So when we want to now distribute these drugs to a pharmacy, we will come back to the menu and select record distribution. This will allow you select the name of the pharmacy you are distributing this medication to. So let's say I am going to take this medication to this pharmacy, for instance. The name is already there. None of the other fields are editable. You can only edit the quantity supplied. I am going to be supplying, we have 2,000 quantity in stock. I am going to supply, let's say 1,500 of the 2,000. And when I got there, somebody named, let me use Lester, received, and I'll click on distribute. So this way, you have on file that you have given that pharmacy that stock, and the system automatically deducts how much you have distributed and tell you the remaining amount you have in stock. In the event where you want to give another pharmacy a stock that is more than what you have in, more than the quantity you have, and you fill it in, it is going to reject the distribution and tell you that the figure you are trying to give is not, you don't have as much as that in stock. So this is how you record your distributions when you distribute to pharmacies. And then you can view your distribution list and you can see when the name of the pharmacy, the drug you gave, the form strength, expiry dates, the batch number, and the manufacturers, and then the packaging, the amount per pack, and the quantity that you supplied and who received in the different places. In the event that any of these distribution is wrongly entered, you can click on the delete button and the system deletes this and gives you back that stock in the list of your stock. So add it back to your stock. So it balances everything, and most of those calculations you will not need to do again. So if I go back to stock list, whatever I returned will come back here. So I returned a particular medication and it will balance it back here. So let's look at the distribution. So we distributed to this. We took 500 from this quantity, 1,500. I want to send it back so that that stock remains 2,000, how it was before we started distribution. So because that was an error in entry, we now have our stock list to have that back to 2,000 in stock. So once you delete something, you don't need to recalculate. The system automatically balances back everything that you missed out. So now we have looked at the functionalities of the central medical supplies. It is not a large functionality, but it can be confusing at times. So when you try hands-on, you will see all of the things that happen and the ripple effects of different things. Most of the work for the drugs is more at the pharmacy permission, where a pharmacist will have the ability to create the stock, to view record, to dispense medications, print labels, and view other patients' prescription-related data on the system. Any question before I move further? Okay, so no questions. So we go to the pharmacy. When a pharmacy receives a stock, so we are going to make this supply back to the pharmacy so that the pharmacy will put in that stock. So I will record distribution. I will send this to some Alex Hospital Pharmacy. I'm going to be giving 1,500, and this is going to be received by me. So the next thing I will do is to come to pharmacy now and create stock. In the pharmacy, once you want to record the stock received, you have to check the name of the pharmacy and make sure the name of the pharmacy you are attached to is your current pharmacy. If I record this stock for this pharmacy, and I'll show you what is going to happen. The names of medication is going to be populated by the names of medications that the Central Medical Store created when they created the medication list. So you will not have any ARV name on this drop-down menu if the Central Medical Store do not put in those stock or those names. You will only find this according to what the Central Medical Stores have. When you select the name, the strength will also be populated by the strengths available in the medication. The form is going to be populated based on the forms available, and the manufacturer based on the list of manufacturers that you have. The manufacturer was not this, the other manufacturer is not displaying, I'll check that. And the expiry date of the medication when we had it was, I think it was August 2022. So I'll put the last day of August. And the batch number of the medication was 01001. The quantity we received was 1,500. Now the system will allow you put any quantity. If you put in the wrong quantity, when the Central Medical Store balances and the pharmacy balances. Now, the way the system was designed is such that whatever quantity, packaging, and amount per pack that the pharmacy enters is not restricted by what the Central Medical Store recorded that they give. So if one person makes a mistake, by the time you are trying to balance this account, you'll find out that somewhere along the line, somebody made a mistake in data entry. So if the Central Medical Store mistakenly put 1,800 and the pharmacy puts 1,500 as the quantity received, then at some point, we'll have to find out where the difference is coming from. So the pharmacies will enter their stock that they received regardless of what the Central Medical Supplies enters on their own system as the stock distributed. The packaging of whatever they received will be populated by the list of packaging that the Central Medical Store has in the different medication, and the amount per pack is 240 mils per bottle. And then I'll add this to the stock of this pharmacy. So the stock has been created. Now, if I come here to view stock, I am going to see all the stock that was entered. So before the presentation, I had entered other stocks to try out. But what the system does is that it will put a list of medications you have in stock that are running low when you have less than 200 bottles or pack, or depending on how it is entered in stock. If you have 0 in stock, it will tell you the medications are out of stock, so you don't bother trying to dispense. And if you have medications that have 6 months or less to expiry, it is going to list them and the expiry date for you so that you can make decisions on how you want to handle them before they are expired. So the pharmacy will see the alert for low stock, for out of stock, and for expired or about to expire medications that you have on your list. And this depends on your entry of the stock received. So it uses the same information to alert you on the medications that are expired or about to expire. Then here, if you have entered any of your stock wrongly, you can come here to edit what you did if you entered wrong. So if Central Medical stores have supplied 1,800 and you entered 1,500, you can come here to edit that and click on the edit button. If you need to delete, you choose reason for recall. So you can also recall here too and click on the recall button. When it is time for you to dispense, you can only dispense what you have in stock from your pharmacy. So if I come to pharmacy and it's time for me to dispense, then when I click on the medication, the name of drug, I will only see the name of drugs that I have in stock and the form and the strength. So while entering the stock, you will see the name of medication Central Medical Stores has that has been distributed. And while dispensing, you see the stock you entered on the system that you have in stock. But we are not looking at dispense today because we are going to look at that next week after the clinical care team gives a set of prescriptions that we are going to try to dispense. Now, what happens when you are dispensing from a wrong pharmacy? I want to assume that I am not supposed to be in this pharmacy and I entered the stock for this pharmacy. When I come to my pharmacy, so let's go to another pharmacy. So my pharmacy has been updated and I come to that pharmacy and I try to check the stock. I would have created stock for a wrong pharmacy, increase their stock for medications that they do not have. But I still have the list of expired or about to expire. Now, what the system has done here, you can, if the Central Medical Store supplies this in excess, so for private pharmacies, and you know it is expiring on the 3rd of in March of 2022, and they're giving you 2,000 stock, and you know you will not dispense that by that time, you can decide to look at your view stock list to see the medication Central Medical Store has entered that is about to expire, so that at the time they are delivering these medications, even if they give you the form to fill, you will know already beforehand that when these medications arrive, you cannot take more than 100 or 50 quantities because it is about to expire or expired. So there will be checks and balances. So in case if it is missed at the Central Medical Stores, you will know the quantity you're ordering based on the expiry date you already know in advance. So by the time you enter your own stock here, it will now tell you the stocks that you have that are out of stock or running low, out of your own stock. So you cannot enter any stock outside of what the Central Medical Store supplies. So it will now depend on the countries. If your Central Medical Stores are not entering into the system, somebody has to find a way to enter, create ARV medication list on the system, ignore the distributions, and so that the system can allow the pharmacies to have a list of medications that they will be dispensing from. But I don't have any stock here because when I entered the stock, I was at a different pharmacy. And when I'm trying to dispense right now, the name of the pharmacy I will be dispensing from will be totally different from the initial pharmacy. And that is the importance of when you log in as a pharmacist, cross-check the pharmacy you are currently assigned and update your pharmacy if you dispense from different pharmacies on different days. So these are the functionalities we have in today's agenda, and I will take questions. And if there are no questions, we are going to use these scenarios to fill in all of this and see how it flows, so that when you have recommendations and questions, we can answer them or we can update the system to suit your need. Okay, in the absence of any other recommendations or feedback, this is where today's session ends. You can tell your colleagues that missed today's session, I will repeat this tomorrow. If you want to join to follow or tomorrow, you feel free to join. But the next session for pharmacy and Central Medical Store, where we look at dispensing and printing out labels based on prescription, will be on the 21st of February. That is going to be one session, and there's no repeat for the one of 21st.